All right, so now we'll have our guest speaker, who is Dr. Pauline Williams Green. She is a family physician in Linstead, St. Catherine since 1994. She's an adjunct lecturer at the Department of Community Health and Psychiatry, UWI. She has published on family medicine education, and she's presently involved in mixed methods research on obesity. She's a former Caribbean College family physician president for the Jamaican chapter, and at the regional level, she is passionate about continuing medical education for family physicians and accreditation of general practices. Dr. Pauline Williams Green.
Thank you very much. And let me just say, unmute myself. Good afternoon, and thank you so much to the Heart Foundation of Jamaica and, of course, the Jamaica Library Service for inviting me to speak on the topic, living with diabetes. Let me just share my screen. And, oops, here we go. All right. Okay. Let me just get this out of the way. So thank you very much for the kind introduction. I have been asked to speak on the topic living with diabetes. And this is, of course, to commemorate, as we have said before, World Diabetes Day. And this is such an important topic, as I hope to share with you later on. So our objectives will be highlighted in the following topics. We'll be looking at what is diabetes, effects on the body, the importance of screening. We'll talk a little bit about knowing some special numbers. And of course, we will discuss nutrition, medication, and what to expect as we go to the doctor's office or to a clinic. So, diabetes, otherwise called sugar or sweet blood. The medical term is diabetes mellitus. And you may have heard of type 1 diabetes or type 2 diabetes, which is the most common. But we also speak of insulin-dependent diabetes or non-insulin dependent diabetes. And we'll talk about this later. So what is diabetes? If you could just focus on the organs in the middle, that little yellow slender organ called the pancreas, that is the part of our anatomy that gets us in trouble. And we'll talk some more about the pancreas. So it's the pancreas that goes wrong or doesn't function well that causes diabetes. And the definition for diabetes is a chronic, which means lasting a very long time, most of our life. It's a metabolic problem, which means it affects the chemical actions in the body that produce energy. And it's focused on a substance called insulin. And insulin controls the amount of glucose in the blood. And of course, we made mention already of the pancreas. That's a gland near the stomach which makes the insulin. So now you understand, persons with diabetes have high levels of sugar, actually a special sugar called glucose in their blood. They do not produce sufficient amounts of insulin, or even if they have a lot of insulin, it is ineffective in the control of blood glucose levels. And what are the effects on the body of this diabetes? Terrible. They cause blindness. It's a major cause of blindness, kidney failure, amputations, yes, loss of limbs, heart attacks, strokes, and yes, it can cause death. Who gets diabetes? We'll talk some more about this. What are the risk factors for getting diabetes? A family history. So if your aunt, your mother, your grandmother, and even cousins have diabetes, there is a greater likelihood that you may get it. And as we get older, our pancreas doesn't work as before, and we can get diabetes. Persons with abdominal obesity, that's the big belly, the fat belly, and this is just belly full of fat, and that puts you at greater risk of diabetes. Sedentarism, meaning you hardly do any physical activity. So physical inactivity, the people who sit behind the desk all day or behind the wheel just driving up and down with a lot of stress, they are more likely to get diabetes. And of course, other comorbidities like high blood pressure. And yes, just being female puts you at higher risk of diabetes. And in fact, more than 230,000 Jamaicans aged 15 years and more have diabetes. More women than men have diabetes. 14.6% of our population, of our adult women, have diabetes, and 9% of our men. So that's a very significant disease. In fact, for women, it's the major number one cause of death. And for men, it ranks number 3 as a cause of death. So very significant. So what are the symptoms of diabetes? What do we look for? There's lethargy, meaning we just feel weak, no energy. Weight loss, yes. When they say your miles go down, think of diabetes. Eating frequently because you feel hungry all the time, or passing the urine frequently. Every few minutes you have to go to pass urine, or constantly feeling thirsty. And let's add blurred vision. Now, no one symptom suggests that it's diabetes. It's a number of symptoms. Several of these would make you think of diabetes. And old-time people used to say, if you leave your urine in the chimney and ants find the urine, think diabetes. And yes, so watching the ants going after your urine could be a way to test for diabetes. But here is how we screen for diabetes. We have to actually stick the finger, get a little bit of blood, just a drop will do. And if you're fasting blood glucose, meaning that you didn't eat anything after 8, 9, 10 in the evening, and right throughout the night you ate nothing, and your first sugar before breakfast is more or equal to 7 millimoles per liter, or in another unit, 126 milligrams per deciliter, and it's more than 7, consider diabetes. Your sugar should not be so high, should not be more than 7. And if at any time you do your blood sugar, and it's more or equal to 11 millimoles per liter, and you have any of those symptoms I mentioned earlier, that suggests strongly that you have diabetes and you should visit your health provider. So let's talk some more about how we take care of the disease. If we have diabetes, our pancreas is not working, what should we do? Healthy eating is paramount. Very important. Physical activity, is also a key element of treatment of diabetes. And yes, there's medication. We do not have a cure for diabetes at this time readily available to everyone. But yes, there is medication. And we also, very important in the treatment is a self-monitoring of blood glucose by checking our blood sugars regularly. So healthy eating, it's not just lots of vegetables, which is very important for everybody. We should all have vegetables at every meal if possible, both raw and cooked. But there are other things we should do. Our aim is to achieve optimal weight, the best weight for ourselves. So once major thrust in achieving optimal weight and getting a diet that's appropriate is to increase the fiber in our diet. And so we recommend eating fiber food, your cereals, and I gave some examples here, bulgur, brown rice, oats, etc. And yes, staples, very good in fiber. However, we need to be sure we don't overeat. Otherwise, some of these staples will convert to sugars and raise our blood sugar. So for diabetics, they should eat their cereals, their staples of sweet potatoes, yams, etc. But the portion size is important. Legumes, yes, feel free to have your bowl of gungo pea soup, but then again, portion size is important. And I've named other legumes here. Leafy vegetables, as well as your starchy vegetables, like your pumpkin and your carrots, but lots of leafy vegetables like your carrot, your pak choy, and so many other things. Fresh fruits, we recommend it. Again, though, a word of caution, fruits contain fructose, which is a type of sugar. And if we eat too much, it will become glucose and raise our blood sugar. So we have fresh fruits in moderation. And of course, a small amount of nuts. Always limit your fats and restrict added sugars. So in terms of meat, reduce the size of meat. Please don't have a pound of jerk pork or jerk chicken. Instead, limit the size to a small portion. And I've suggested to use a deck of cards in your mind to have an idea of what a portion looks like, okay? And do not add sugars to your juices or sugary foods, pastries and cakes. Those should be rare. Avoid those. Avoid processed meats, fast food, packaged foods, because they add sugars and salts to these foods and they become what we call calorie dense foods. So avoid those. And yes, I mentioned this is an important component. The second component after you're managing your diet is your physical activity. And you do that to lose weight if you're overweight, but even if you're underweight, you still engage in physical activity to increase your fitness. We suggest at least 150 minutes throughout the week, which adds up to about 30 minutes for about 5 days. Make sure your physical activity, this 150 minutes is added to your usual activity. So maintain an active lifestyle to fit your physical capability and do something that you can sustain. Don't try and kill yourself by jogging or Blue Mountain today because you can't do that next week or tomorrow. Try and do something which you can be consistent with. And I've given you a website here called hasfit.com, which gives exercises for persons with disabilities. You remain seated while doing these exercises. And I've used them with my patients and they are useful for those people who have limited mobility. And the Ministry of Health and Wellness has physical activity resources on their website. Yes, we got to take medications, and there are some persons who just with diet and physical activity alone can manage their diabetes. They need nothing else. However, most of us have to take medications. And what do the medications do? They make the little insulin that you are making work better, more effective. And some of these medications will get the pancreas to make more insulin or cause greater secretion of insulin into the gut so that we can absorb the sugars or the sugars out of the blood. And they also can reduce the absorption of sugars in the body. So medications help us to control the blood sugar. And if we do not, if that isn't enough, if the medications are not effective, we have to give you the insulin. Without insulin, you die. You die an early, terrible death, as we had mentioned earlier. So we actually have to replace the insulin. And we give this through injections. So some of the persons who are diabetic are what we call, I mentioned earlier, insulin dependent, and therefore must take insulin. It's a little needle given under the skin. And so we call them insulin dependent diabetics. And let's not forget our visits to the health practitioner. So we visit our clinic or visit our doctor. And why do we need to visit our doctor? To take care or to manage our diabetes? Well, we need to monitor our blood pressure because blood pressure impacts on our blood sugar. They go together. We need to also manage our blood sugar. So although you will test your sugar at home, we test the sugar at the clinic or health center as well. We check the level of cholesterol simply because high cholesterol and high blood sugars is a dangerous duo. They're like the deadly duo. It leads to greater complications, and therefore we must check our cholesterol to keep them under control. We also check the kidney function. We need to do this through our visits to the center. We do eye checks. Remember I mentioned blindness, a major complication, so we have to do eye checks. And foot care. We inspect the feet, we check for calluses, we check for cuts, and we check for pulses, we check for your sensation in your feet. So foot care is done at your health center as well. And the objective is to prevent complications, blindness in the eyes, heart attacks, kidney failure, and problems that could lead to us losing our feet. We encourage compliance or adherence with medication, and we motivate patients because managing diabetes is a challenging illness. We always have to be alert, looking at what we should eat, taking our medication, managing our physical activity. So we need help. We need to form a body system. So part of visiting their doctor is to receive encouragement, advice, counseling, and reassurance. And yes, another deadly part of the deadly duo is depression. Diabetics tend to get depressed because it's such a challenging illness at times. So we identify and treat depression in the health center setting. It's very important. So we have been talking about living with diabetes. We have said it's a major cause of illness and death in Jamaica and the world. And we are highlighting this in this World Diabetes Day event. We recommend screening by testing our blood glucose. And we have spoken about treatment by managing our diet, engaging in physical activity, taking medication, and monitoring our blood sugar to prevent complications. Thank you.
All right, thank you so much for that very informative and interesting presentation, Dr. Pauline Williams-Green. And I am pretty sure that our audience who's tuned in right now have learned a host of information. And, you know, like, I mean, seeing that we're celebrating World Diabetes Week, not just the day. And I'm hoping that, you know, while we're listening, we're not just going to take this information and just say, you know, it's going to be a one-day thing. It's a way of life. We must apply these principles and this knowledge that we have gained today into our routine, our daily activities, and going forward. And we can, you know, set a foundation for future generations to come. So I do thank you so much for that.
You're welcome.
Okay, so at this minute, we are going to close off. However, we do have a 5 minutes, 5 minutes to spare for anyone who has a question for Dr. Pauline Williams-Green. You can go ahead, feel free to ask. If you're not able to voice your question, you can go ahead and type it in the chat on any of the platforms that we're currently streaming on, and we will proceed to answer your questions as soon and as best as possible. Okay, so I'm not seeing any questions in our Zoom chat. So let me go over to our YouTube to see if there are any posted there. Okay, so I'm not seeing any questions within the YouTube chat section either. So
we have a member of the public who
okay.
Would like to ask a question.
Okay, sure, go ahead.
I am diabetic, 71 years old, Sweden. I've almost for the last 20 years. Is there any possibility of a cure in medicine? In medicine, in the way are they thinking about it? Cure.
I heard. You're asking, is there a possibility of a cure for diabetes? Is that the question?
Problem on the street. Up to last night, these guys are studying these things. You probably know about them. That cure everything, including diabetes. Now I'm sure. Anyway, I'm sure you have an opinion on this, but I'm just saying that is there in medicine? Is there any hope? Even not for me, but certainly of a generation that there can be a cure for diabetes.
Hassan, that is an excellent question because the answer is yes.
Oh.
Yes. They have how can I say, scientific studies have shown a cure for diabetes. Remember I said the majority of persons with diabetes have type 2 diabetes. And usually these are obese persons.
Yes.
And they have actually shown that by losing significant weight, it is possible to reverse the diabetes. There is a procedure called bariatric surgery. And these obese persons lose significant, 30%, a third of their weight sometimes. And this actually reverses the diabetes. So yes, there is a cure for diabetes. You may ask, what about the slim persons? Not quite so easy, because diabetes is not one disease. Although I said I explained that the pancreas doesn't work well, the insulin is either insufficient or what there is doesn't do the job. And because there are different causes of the diabetes, the cures will vary. But certainly for the obese person, I talked about the big belly, and bariatric surgery has reversed diabetes. What about what you mentioned, the bushes, the liquids, the pills, they don't cure them. There's no cure at this time. I'm sure perhaps in our lifetime, who knows? Because so many things are happening with genetic engineering. Things may happen. But at this time, we don't have a cure that's readily available to the majority of us. What I will tell you, just by losing 10 kilograms, right, or even 5 kilograms, it improves the control of diabetes significantly. And it's not just lose it today and put it back on tomorrow. It's taking off that weight, which is superfluous, the fat that we don't need, and maintaining an optimal weight. I did not say ideal. I did not say look like a model that's going on the catwalk. I'm saying an optimal weight for each individual. It can help or reverse the diabetes. So that is the option we have, which is within our own reach. But it's difficult because of the foods I told you should avoid or restrict. Unfortunately, they are plentiful. And many of us are inactive. We get stressed out and tired, but we don't do any physical work. So if we can apply the first two steps I mentioned, which is the managing the diet, eating healthily, and the physical activity, that will go a far way in reversing some of the diabetes for some of us, and in some, and certainly helping the control, reducing the complications, and reducing the need for excessive medication. But bariatric surgery has reversed and cured diabetes.
Any connection between gaining weight and having diabetes? Because I noticed that people like myself, I was so slim, active, very active sports man. And then this weight, I don't think I've eaten more than I don't think so. But I mean, is there a connection about weight gain versus?
Yes. The simple answer is yes. There's no doubt that weight gain, significant weight gain, and that's causing obesity. Yeah. I didn't go into a lot into it, but once you are significantly overweight, it puts you at much greater risk of developing diabetes. And go ahead.
There's no connection. Diabetes doesn't lead to the overweight, right? That's what you say. That was the question. Being diabetic, does it contribute in any way to you being overweight?
Oh, you mean the diabetes itself? Yes. The answer again is yes. Being diabetic does contribute to be putting on weight on several fronts. Firstly, if you're on medication, some of the medication can lead to weight gain. A particular group that we use is called the sulfonylureas. Sorry to give you a big word. Some of them do lead to weight gain, and it's well recognized, which is why we encourage exercise and managing your portion size, because we know some of the medication will do that. Diabetes itself, remember I said there is a family history, so there's a genetic prevalence, yes, towards weight gain, and that weight gain will be associated with diabetes as well.
Yeah. Understand. They've been very informative and articulate, so thank you very much.
Thank you too for asking. I hope I helped to enlighten. What I'd like to leave with you is that it's in our hands. We can predict the future by helping to manage our weight. Thank you.
All right, there you have it, ladies and gentlemen, from Dr. Williams Green, our presenter for this evening, who is a family physician in Linstead St. Catherine. And as I said before, I'm pretty sure we all learned from this session. And as we close off, I'd like to encourage our audience to remember we are having a display here at the Jamaica Library Service, so you can come on out and actually, you know, learn some more about diabetes. If you have questions or concerns, feel free to forward them, and we will be, you know, we are here to assist and provide answers as best as possible. If we are not in the capacity to do so, we will forward them to the respective professionals who will be better able to assist you and provide answers. We will meet here again on November 16th at 2 p.m., right? And we will be talking about the role of nurses in managing diabetes on that date, since that's the theme of World Diabetes Day this year. So I do thank you for coming out and joining us and participating in this session, and we look forward to the week to come. Have a lovely weekend, everyone.